I was feeling stressed, driving through a new neighborhood, the GPS leading me astray. As I rushed to find the right apartment, the patient's husband called to me from their patio door. His wife was sitting on their couch, visibly unwell. One son sat across from me with his dad, while the younger one ran in and out of the room. As we visited, I realized that they were invested in a miraculous outcome. Knowing that her prognosis was short, I tried to give them resources that would offer support, but I could tell that they were not going to follow up. I tried to engage in a discussion about goals of care, but we were on very different pages. Eventually, I said, it is wise for all of us to prepare for the worst at the same time as we hope for the best. The husband looked me in the eye and forcefully said, "We will never prepare for the worst." In my 17 years as a clinical nurse specialist on the Palliative Care consult service, I had never encountered a more assertive objection. When I left, I wondered if I had done the right thing. Should I have been more emphatic or forceful? Did I fail that family, those kids, by not convincing them to prepare for her death? Six months later, I received my own palliative care consult from a physician I had worked with closely. Neither of us was expecting much. I immediately started planning the end of my life in the way that I thought was right. My goals of care document was on the fridge. I met with my minister to plan the funeral and paid for everything. I bought a cemetery plot. I started creating memory boxes for my grandchildren. I decluttered 20 years of stuff from my house. I started planning as many family get-togethers as I could. And I began writing a blog to keep people updated. I did everything exactly how I had counseled others in my situation. I felt good about it, and people noticed. One day I received an email from a friend suggesting that I did not have to always be so positive about my situation. It was clear that she thought I was trying too hard to live up to a certain ideal and was not expressing how I truly felt. I sat looking at the computer screen, reflecting on her reaction. I had written on my blog about the grief I felt in knowing that I would not be able to watch my grandkids grow up, and my regret about the burden my children would experience. But the activities that helped me prepare for my death were actually positive and pleasurable for me. I wanted to live as well as I could until the end, and I thought I was. Was I angry? Over the years, I had many patients who were younger than me. It never occurred to me to ask, why me? I thought, why not me? No, I wasn't angry, and I didn't like the suggestion that I should be. Sitting there at my desk, I realized that in my own nursing practice, I was right to allow people to walk their end-of-life journey in their own way, even while I offered them the opportunity to make other choices. Preparing for the worst did not prevent the best from happening. And it is affirming to know that the advice I have been giving patients has been valid in my own life. I feel more than ever that there is no one best way to die. We need to be there to support people on their own path.